When you get imaging results for mesothelioma, the radiology report is filled with medical terminology that can be nearly impossible to understand. Phrases like pleural thickening with modularity, SUV max of 8.5, or mediastinal adenopathy. Today, I want to walk you through how to read your CT and PET scan reports, explain what the key terms mean in plain language, help you identify the most important findings, and show you what questions to ask your doctor about your imaging results. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding your imaging reports empowers you to participate actively in treatment decisions. So let's start with CT scans. CT stands for computed tomography, and the scans create detailed cross-sectional images of your chest or abdomen. The radiology report typically has several sections, with the indication or clinical history section stating why the scan was ordered. It might say evaluate for mesothelioma, restaging after chemotherapy, or something similar. The technique section describes how the scan was performed, with or without IV contrast, the type of scanner used, and the slice thickness. You really don't need to understand this technical information. The comparison section, if it's present, indicates what prior scans are being compared to the current one. Comparison is crucial for assessing whether the disease is stable, improving, or progressing. The findings section is the most important part. This describes what the radiologist saw, organized by the anatomical region. For pleural mesothelioma, key findings to look for include pleural thickening. The report might say circumferential pleural thickening, meaning the tumor is encircling the lung. Modular pleural thickening, meaning an irregular, bumpy appearance, suggesting that there's a tumor rather than scar tissue. Or measurements like pleural thickening measuring up to 2.3 centimeters, indicating the thickness. Pleural effusion refers to fluid in the chest cavity that often accompanies mesothelioma. The report might describe it as small, moderate, or large, or it could give measurements. Lymph node descriptions might include mediastinal lymphadenopathy, meaning enlarged lymph nodes, in the center of the chest, with measurements like right paratracheal node measuring 1.5 centimeter. Nodes over 1 centimeter are concerning for tumor involvement. I have a lot of information to cover, so I want to take a quick break and ask you a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us like you did. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Invasion descriptions might mention extension through the diaphragm, invasion into the pericardium, chest wall invasion, or encasement of mediastinal structures. All of these indicate the extent of tumor spread. Distant findings section might note hepatic lesions concerning for metastasis, lytic bone lesions, or adrenal nodules. These are all locations of potential distant spread. For peritoneal mesothelioma, key CT findings include peritoneal thickening and nodularity, ascites, which is abdominal fluid, omental caking, which is thickening of the fatty apron covering the intestines, called the omentum, implants on bowel surfaces, liver surface lesions, and measurement of peritoneal nodules. The impression or conclusion section summarizes the scan's key findings. This is what your doctor is going to focus on. It might read, findings consistent with malignant pleural mesothelioma with circumferential right pleural thickening, moderate effusion, and right paratracheal adenopathy. No definite distant metastatic disease. Or it might say interval decrease in pleural thickening and resolution of effusion compared to prior scan, consistent with treatment response. Now, let's discuss PET scans. PET stands for positron emission tomography, which is often combined with CT as PET-CT. It detects metabolic activity. Tumors are metabolically active, so they're very, very valuable. The scan reports include similar sections to the CT scan, but they add the metabolic information. The key measurement is SUV, standardized uptake value. This quantifies how much tracer is accumulating in your tissue. SUV max is the maximum SUV in a region. Background tissues have low SUV, typically 1 to 2. Metabolically active tissues like brain, heart, or bladder normally have higher SUVs. Cancer typically shows an elevated SUV because malignant tumors are active. For mesothelioma SUV, interpretations would include SUV max 2.5 or less. It could be benign inflammation or minimal metabolic activity. SUV max of 3 to 5 is intermediate. It could be inflammation or low-grade malignancy, and an SUV max above 5 to 8 is highly concerning for active malignancy. An SUV max above 10 indicates a very metabolically active tumor. However, SUV must be interpreted in context. Some aggressive cancers have a modest SUV, while some inflammatory conditions have a high SUV. It's one piece of information, but not definitive on its own. PET findings for mesothelioma might describe intensely FDG avid circumferential right pleural thickening with SUV max 12.3. This means a very metabolically active pleural tumor. FDG avid right hilar and mediastinal lymph nodes with SUV max up to 8.7 means metabolically active lymph nodes that are concerning for tumor involvement. No FDG avid lesions to suggest distant metastatic disease means there's no metabolic evidence of distant spread. What about comparing scans to assess treatment response? This is where radiology becomes critically important. The comparison section should reference prior scans. Look for phrases like interval decrease in pleural thickening from 2.8 centimeters to 1.9 centimeters. Tumor shrinkage reflects a positive response. Stable pleural disease compared to prior means there's been no change, so the disease is controlled. Interval increase in pleural thickening and new mediastinal adenopathy indicates disease progression. For PET scans, metabolic response is assessed by SUV changes. Decrease in SUV max from 10.2 to 4.8 means significant metabolic response. Stable metabolic activity means disease control, and increased metabolic activity with new FDG avid lesions means disease progression. Formal response criteria use standardized measurements. RECIST criteria, that's RECIST, standing for Response Evaluation Criteria in Solid Tumors, classifies responses as complete response with all measurable disease disappeared. Partial response means a 30% or greater decrease in tumor measurements. Stable disease means there's been neither sufficient shrinkage for partial response nor an increase that's enough for progression. Progressive disease means a 20% or greater increase in measurements or new lesions. Modified RECIST for mesothelioma accounts for the fact that mesothelioma spreads as sheets rather than discrete masses. That makes standard RECIST challenging. What should you do with your imaging reports? First, always get copies for your records. You're entitled to all medical records, including imaging reports and actual images on disk. Second, read the impression section first. This summarizes key findings. Then read findings if you want more detail. Third, make a list of terms or findings you don't understand and ask your doctor to explain them. If you're being evaluated at multiple centers, bring your imaging disks, not just your reports, because different radiologists might interpret the same images differently, and your new doctors will want to review the actual images. Make sure you understand that radiology reports describe what the radiologist sees, but they aren't diagnoses. Phrases like concerning for malignancy or suspicious for tumor involvement mean the radiologist thinks it looks like cancer, but a definitive diagnosis requires biopsy and pathology. What questions should you ask about your imaging? Start with, what are the most important findings? Has my disease changed compared to prior scans? Is it stable, better, or worse? Do the findings change my treatment plan or prognosis? Are there any findings that require further investigation or biopsy? And should my imaging be repeated, and when? Now, what if your imaging results seem inconsistent with how you feel? It happens. Scans might show stable disease while you feel much worse due to symptoms like pain or fatigue, or scans might show a progression while you feel fine. Scans measure tumor size and metabolic activity. They don't capture everything about the disease's impact. You should discuss these discrepancies with your oncologist because symptom management can address the issues you're experiencing even when your scans show stable disease. And sometimes scans reveal progression before symptoms develop, and that allows for earlier changes in treatment. Can imaging be wrong? Radiologists are highly accurate, but interpretation involves a degree of subjectivity. Equivocal findings might be interpreted differently by different radiologists, which is why second opinions on imaging are reasonable, especially if findings significantly affect treatment decisions. To review, CT scan reports for mesothelioma describe pleural or peritoneal thickening with measurements and characteristics like nodular or circumferential, effusions or ascites, lymph node enlargement, invasion into adjacent structures, and distant metastases. Focus on the impression section for key findings. PET scans add metabolic information with SUV measurements. An SUV max above 5 to 8 suggests an active malignancy. Comparison to prior scans shows response, stability, or progression using RECIST criteria. Always get copies of reports and images, ask your doctor to explain unclear findings, and understand that imaging guides but doesn't replace clinical judgment. You can visit mesothelioma.net for more information about mesothelioma imaging and staging, or call 1-800-692-8608 or use the live chat feature on our website to speak to one of our patient advocates immediately. As for me, remember to post your questions below, and I'll see you next time.